What are the 4 parts of Medicare? I like to explain the 4 parts of Medicare by looking at the history of Medicare. So if you look behind me, you're going to see that Medicare was first born in 1965, and at the time when it was first being offered to Medicare beneficiaries, it only consisted of Medicare Part A, which is your hospital coverage, and then Medicare Part B, which is outpatient coverage, doctors, lab services, etc. So that's it. That's what Medicare consisted of. And Medicare A and B are handled by the Centers for Medicare and Medicaid Services, as it still is today. Then in the late 1990s, there was legislation passed which introduced the concept of Medicare Part C, which is Medicare Advantage. It gives the Medicare beneficiary an option to have a private insurance company, managed care, handle your Part A and B services. So what happens is either you choose this path or you choose this path. It's one or the other. But everybody who goes through Medicare Part C first does have to sign up for Medicare Parts A and B through the Social Security Administration. Now, it wasn't until 2006 that Medicare Part D was first introduced, and that's where you get prescription drug coverage. And you have a choice. You can get an independent Part D plan if you stick to this path, original Medicare with the Centers for Medicare and Medicaid Services, or in the alternative, you can have prescription drug coverage, like have Part D built in to a Medicare Advantage plan, Medicare Part C. So those are the 4 parts of Medicare. Lots of more details to follow, but click here to learn more if you want to connect with me.